this is a big announcement that the administration is very excited about it and is very proud of. Just for someone that is unfamiliar, kind of walk through the process and how we got to this point.
So, as you know, Eric, about a year ago, the president and Democrats, only Democrats in Congress, was able to pass the Inflation Reduction Act, which is one of the provisions, which is a game changer, which is what we're seeing today, is that it gives Medicare the ability to now negotiate as it relates to prescription drugs, which is huge. Let's not forget, for decades, like 33 years, leaders have been trying to get this done, and they were not able to get this done. And this is a president who has got it done. And by doing that, he beat Big Pharma. Just think about this. Big Pharma would spend hundreds of millions of dollars to really stop this from happening, to stop lowering costs for American families. Where, if you think about this even broader, right, American families had to make decisions every month. Right? They get around the kitchen table. You hear the president talk about this all the time, and trying to make a decision on what is the most important things to pay for. And some Americans have to decide that they can't pay for in really important prescription drugs because of the cost. And so you think about these first 10 drugs. This is the first tranche of drugs that are moving forward, that Medicare is going to start negotiating on. These 10 drugs, just last year alone in 2022, cost $3.4 billion to Americans. That's about $6,000 out-of-pocket expenses for one drug. And so by this happening, it's going to save 9 million people money, right? That 9 million Medicare beneficiaries. It is a huge, huge step forward. And what the president wants to do is making sure that we lower costs, especially healthcare costs for American families, lowering costs more broadly for American families. Part of Bidenomics, you hear talk about that. And it is a history-making moment that we are incredibly proud of. And the president's talking about it today. I'm here talking to you about it today. We are out there making sure that Americans in California and San Diego knows exactly what we're doing for them, what the president's doing for them, and what's about to happen.
Talk about how these first 10 drugs were chosen, and just kind of, I think Eliquis is one that a lot of people have heard of, and things along those lines. Just kind of break down the significance of the drugs that were chosen as the first 10.
So it's a good question. Human Health Services, they make the decision on the drugs that were chosen. There's criteria that is in the provision for the Inflation Reduction Act. I can't really get into details about that, but there are criteria that is included in that provision in the Inflation Reduction Act. And these 10 drugs actually made those criteria. And let's not forget, when I'm talking about drugs, these are drugs that are going to help people who have heart disease, who have blood clots, who are dealing with cancer. Like, these are major critical drugs for American folks across the country, including clearly in San Diego. Now, if folks do not see their drug on this list, do not be deterred. Those drugs will probably likely come down the future. But again, $3.4 billion these drugs cost Americans in 2022 alone, and this is going to help 9 million Medicare beneficiaries. And so that is so critical, and that is so important as well.
So you may have heard some of the drug companies are not thrilled about this. There's already been some legal challenges, as I am sure you're quite aware. They have on a number of different grounds. What's your view on that in general? And then, do you think, that what you have is going to withstand all of that, and you'll be able to implement this starting in 26 or however that timeline goes? How confident are you that the legal process will play out?
No, appreciate the question, Eric. Look, we're pretty confident. If you look at the Constitution, nothing in the Constitution says that Medicare cannot negotiate with pharmaceutical companies. There's nothing that says that in the Constitution. So we feel very confident about the law. We feel that we will prevail. We feel like we are in really strong legal standing ground. And so we're going to let that legal process move forward. The Department of Justice is going to deal with that. But again, we feel very confident. Look, as I mentioned, the president beat Big Pharma. This is what happens, right? Big Pharma tried to prevent this from happening for years and years and years. I mentioned 33 years, for decades. Elected officials, leaders have been trying to get this done. They were not able to do it. So what I want folks in San Diego to know, what I want folks in California to know, is that this is a president that has beaten big pharma, period. And with the help with Democrats, only Democrats in Congress, because that's how the Inflation Reduction Act was passed, with only Democrat support.
So last one, and we'll get you out of here. Kind of walk us through the timeline of how things will work. And San Diego has a lot of seniors, and we have a lot of people that would potentially benefit from something like this. Kind of talk about that savings and that timeline. So when San Diegans can really expect to see that benefit.
And also a great question. Look, this is the negotiating process is going to begin. It's starting. We're in that process. It's going to be in that process soon with these 10 drugs. So we'll have more on the specific costs and savings. We know it's going to help 9 million Americans across the country. That's incredibly important. You mentioned 2016. That's when, we're going to start seeing some effect here. But the Inflation Reduction Act, we've already have seen how it's helped as it relates to healthcare, right? We can talk about 15 million Americans who are saving $800 a year because of the Inflation Reduction Act. You hear us talk about the cap on insulin, the insulin cap at $35 per month for seniors. That's already helping Americans out there. So we have seen the effects of the Inflation Reduction Act. This is just one provision, a critical provision that we're announcing today.